So because they are what? Acid urine. And you're able to tolerate that and so you relax. So if everything is normal, but it end up with health, but if all of this changes, you're going to end up with disease. So why is this important? Because this explains ecologically why we have to look at how we manage here. Okay, so we need to do this by prevention. So we need to make sure that we're targeting bacteria, but not only the relevant bacteria. We want to make sure that we're controlling the environment factors. And if we don't know what those factors are, then we can't control them. So that's why we're going through this process. So what do? We want to inhibit plaque acid production. How do we inhibit plaque acid production? Just on the top. Reduce. Yeah, reduce the amount of carbohydrates. That's an easy answer. What else? What'd you say? Simulate saliva. What's that going to do? So the saliva does a number of things. So we're going to investigate that. What else? We can encourage hygiene to be disruptive there. We can use antibacterial agents like fluoride, xylitol, all the way to salivation. It is also an antibacterial. But you know, it's all of your armamentarium that's available to you, just like I know spoon and the explorer and the bird. You need to know what your armamentarium is available to you so that you can apply for your patients, depending on what their needs are. So, decrease the consumption of your back, increase the consumption of non-fermentable carbohydrate. Put substitutes in place. So by knowing what the carbohydrates you are not acid or are not fermentable, you can also help that. And then make sure you have measures celebrate. So that's where we're going. Okay, so we're going to give this a salivary gland. We're going to have example. I want you to know what this is. Basically, we have three types. Each one is injuries. Okay, there's what else? Minor salivary glands. Okay. Then you have something different gland that you spoke. Make sure you know the ducts, empty ducts, and so what. Make sure you know what work is done. Be able to do your own examinations to find these areas because you are going to have to milk those glands to make sure there is a pass. So saliva flow can be affected by medications, can be affected by radiation, but it can also be affected by blockage. So if you don't have open ducts, then you're not going to be able to get saliva where you need. Okay, so there's different ways to assess ducts. Let's see, innervation. So the parasympathetic is primarily the innervated body, and it favors the serious secretions of the nerves that are involved by visual and facial nerves. Sympathetic deals with, and this is kind of neurotransmitter, deals favors mucus and it deals with more epinephrine. So these attack receptors. So you need to make sure that they automatically know, understand that they enter. That they affect calcium, they also affect membranes. So you're looking at how the tools that you are using are going to affect the cells that of the bacterial walls and their metabolism and their presence. And saliva basically contains organic electrolytes that help. Those electrolytes are somewhat associated with saliva. So when you look at saliva, you're going to understand the properties of it. Properties are physical, chemical, and bacterial. Let's so be familiar with what saliva does. How many of you have done more exams this far? Are you going in and actually looking at the saliva and seeing what, and whether it's more serious or a good combination of both? Are you looking to see if it's protein? Are you paying attention to its viscosity and its flow? Because I want you to make sure you're starting to do that. We're so focused on teeth, not always dealing with the rest of the environment. So a stimulated flow rate will be 0.4 milliliters per minute. Stimulated will be 1.5 or 2 milliliters per minute to 2 milliliters. What do I mean by stimulated amounts? How can I stimulate salivary flow?
Put in food,
That's what you know.
put in something in the mouth.
So putting something in the mouth that stimulates. Okay, saliva production and excretion. And so what kinds of things can you think of off the top of your head? And so we are lucky that there was and there are studies that show just chewing gum will enhance the amount of saliva in the mouth. But if you add a stimulant such as xylitol to the gum, it will even further enhance saliva production. So that's why you want, so and of course there are drugs that you can use. I mean, honestly, a lot of people talk about saliva. So that's something else you want to do. But you need to know these values. So we're going to check certain qualities of the saliva based on these values. The most produced is 0.5 to 1 milliliter to 1 milliliter per day. Don't you do that much? Then 90% are secreted by the main salivary glands. Now, what's its purpose? But it's not the sole purpose, but in association with caries, that which use those acids. But what the chemical qualities? Well, the chemical takes electrolytes that minimize or decrease with pH and a failure of mineralization. So you think about sodium bicarbonate, and also phosphates. These are the consistency of these are regulations of offering and neutralizing the agents to survive. Saline is a salivary protein that raises salivary pH to a neutral level. So we need to take a look at that and make sure we understand that if we saw that, we need to know that. It's a protein. Supersaturated with hydroxy apatite, fluoride, and calcium, phosphate iron is another feature. Statins and protein-rich proteins maintain the saturation and the likelihood of mineralization. So we're always because they increase the calcium phosphate area. And we want that. We want the saturation of calcium and phosphate. Why do we want that saturation?
Helps with remineralization.
Because we want to maintain balance. We want to keep that surface bathed with minerals to enhance the likelihood of slow caries production as well as remineralize the tissue. Now it also has antibiotic properties. Now it's not we're not going to call substances antibiotics, but it's the way that their actions occur make them antibiotics. So you're looking at a mucin. It traps, it aggregates, and it clears bacteria. You're looking at the amylase that you will always see in ERT, you will always see salivary amylase. Have you heard that before? So that's something else you want to take a look at. It breaks it down to food part because it sticks to teeth. It reduces bacterial buildup. And then you have lysozyme, it's a cationic protein, and it messes with the cell wall of the bacteria. So it basically inactivated that. Lactoferrin, it binds iron. Lactoferrin binds iron, which is essential to bacterial growth and survival. And then finally, we have oxidase, which causes radical compounds, and those bacterial cells are basically causing self-destruction. So you need to know the methods by which the substances that are in saliva take their action. There's also the immune response. So I'm talking about immune response of the. So there are physical chemical barriers, non-specific, and specific adaptive immunity factors. Basically, there's going to be an increase in IgG when the environment is exposed to bacteria. The increase in immunoglobulins when there is exposed. So let's just talk briefly about secretory IgA. This is dominant lifting health is produced by the gland associated with the, and it has immunocytes, not granules, left band area. It's pink areas, it's brown circle, those are immunocytes. They're scattered around the axonite receptor ducts. So they're present on site that. There's the molecule, the substance itself is composed of two chains, one heavy, one light, like J chain. And this basically glucanates bacteria such as mutans as well as modulating the enzyme activities. So it's playing a role. However, while it interferes with conversation, it is a poor activator of populate, which means it does not clear well. As well, it's poor oxidizing, which means it's not effective in status symptoms. And that's important to notice about. I'm when we look at in the vitamin G, this is found in it's a blood exudate that's present all by the but plasma level pockets is later on. So I wouldn't be surprised if this is a topic discussed with your parent. It's response to the presence of microbial agents is going to increase this substance in the general. It was prevents the current status of plaque fellows access in that area. So we can expect. This, on the other hand, because public school vitamin A is a strong complement complicated oxidizing substance. It leads to vitamin B cytosis. It may play a role in modulating. So no difference between IgG and IgG. So these are contained in the saliva, which allows it allows this really just allows saliva to move about lubricating or tissues and makes teeth and biofilm. So what might be a presentation for a patient who has a low salivary? We have got what else? Think about the muscle tissue. They're going to dry, their lips are going to stick to their teeth. So these are things that you need to be paying attention to. We get so focused on going straight to the teeth, we're not always paying attention to the little things. Reviewing your patient's medical history, knowing what drugs they're taking, and know what their experience would be as far as radiation is concerned. The salivary glands are very epithelial, they're very sensitive to radiation. So these just enhance your awareness. It provides a flushing effect, which helps us when we write organisms. It produces these antibiotic products that we just got discussed. It carries susceptibility in healthy patients, healthy individuals, but not related to salivary composition. Individuals with decreased salivary production, they have significantly higher Caries rates. We talked about that last week when we were looking at patients, the elderly patients, who's on older, does not mean that my saliva is not big. Okay, so don't make assumptions about your patient. It could be ever had radiation treatment, but that doesn't mean my saliva is not big. Okay. So we're looking for saliva bacterial clearance in general, direct antibacterial activity, be a buffer and assist in immunization through blood activity, presence of blood, calcium, phosphorus, and if we have it available for it, critical and control the seal. So other capacity is carried out by bicarbonate ions, and we may be able to assess the quality of the buffering capacity in saliva. We can also test the patient for the salivary flow rate, the pH, and the buffering capacity. And so people do this through titration techniques. There are 6 developed market. So I created a a video for you. For you all to review and go through the process of having a patient do a lower test, like this check, check, so I have a check under. And so this is a true, this is 7 patients that. So we already talked about survivor criminalization and criminalization. We said that it's influenced by the survivor, facilitates the transportation of the ions that we just talked about. Also modulates the bacteria, the formidable carbohydrates that are exposed. So would it be saying? Would we say there are types of carbohydrates? Fermented fermented, what else? There, you have monosaccharides and disaccharides. So what is a fermented carbohydrate? It's simple sugar, right? So I put this, so how that you make sure you have that this is a lactose one that's not compared to sugar in there because I said. So it's complex relationship that we have to understand for the time periods. So that's the least important, there's at least important areas, meaning the buffer capacity, cleansing, antibacterial, as well as maintenance of and supersaturation of calcium in the body. So, just generalizing the summary, we have adjuvant utilization, buffer capacity, lots of density and calcium phosphate, as building blocks, or hydroxy appetite. We have maintaining equilibrium, about creating a balance between the hard tissue, surrounding fluids, ensuring integrity. We have the role of the pellet. What's the pellet? What is it pellet? That's the first thing. The fact things in which to that's the first thing that you want. Here we feel that what happens that the biofilm actually attaches. So it is a protection for the tube, but it also is a home. The bacteria is being. So calcium phosphate are involved in the process of provide intelligence. So that's important, another important feature of calcium phosphate. Saliva also seems to us taste. Transport taste substances, protection of the taste receptors that are better for where the taste buds in the bowl. Where the taste buds. The tongue. Where? So the posterior lateral aspect, right? Okay, so you all need to make sure you know where the taste buds reside on the mouth. Okay, what you do. Make sure you know all the features of those. What happens when I have just think about this, you don't have to do this. What happens when I have a patient comes in and they have a level surface on their tongue? Have you all done your possible changes in the substitute change, right issues where they get but did you almost study it tomorrow? So that's the point. Okay, one point is if you have a patient that has rough areas in their mouth, your tongue is going constantly right over, then you're basically abrading the tongue. So what would be the responsive cell to that? Or the tongue was the responsive cell. The epithelial cell. So if the epithelial cell is traumatized, people are actually going to respond. And I have increased irritation to the tongue or surface, then I'm going to increase the cellular development, proliferation, and I'll end up with a hyperplastic appearance. That is going to manifest itself as a white lesion. Just like if your nails are close too long, you can then speak out over the blood of the Or, yeah, look past the deal with where your blood circulation is, then they're going to be white. Okay, that's just the way it deals with us. Because of that, where you are in the body, you have a hyperkeratotic activity or irritating activity, then you will likely goes on that like and it's not making cancer, makes it white. Okay, so closing. I think this slide does a wonderful job with helping you understand all of the things this lab institution do. If you find something what you have to talk about, we talk about lubrication. We talk about it as the ion goes far. Talk about its buffering capacity. We talk about its cleansing capacity. We talked about its antimicrobial action, its illumination action, its pelvication role, digestion, taste, excretion, and water balance. So isn't this a dynamic substance? And so all of these things can be thrown off. There's something wrong with cell survival. And that's why I'm just going to magnify this morning because it's a forgotten theme of it now. And we need to be paying attention. Thank you very much. And we will continue with our Caries success. Back.
And it's just there's
I was reading an evaluation, and it said Dr. Pryor is, I don't think she actually saves these, but I don't think she reports, but she doesn't want us to have. And I want to let you know that's not true. That's smart classrooms. It's very close to report. So please don't ever say that I'm trying to do something worse. And I'll put that in my next syllabus. That's not what I'm.